Hi and welcome. I'm Dr. Donato Zizi from Skinfinity, and today I want to speak about a very interesting technique that is called Micro Lipofilling, that is used to regenerate and rejuvenate the skin tissues. Basically, the technique is based on the harvesting of the fat cells, so this is the first step, and the fat is removed manually, very gently, in order not to damage the stem cells, which are the cells that we really need for our purposes. After the harvesting, we have to process and centrifuge the fat in order to isolate the stem cells together with the stromal and vascular cells that are the magic mix that will promote the therapeutic effect. After we obtain this solution, we simply have to inject it into the skin, and the technique is exactly similar to a filler treatment. In fact, we use the same needle used for the filler, and basically there are no side effects and no downtime, unless a little bruising sometimes or a little swelling that can be easily hidden with some makeup. So basically we can summarize the procedure as aspiration of adipose tissue with a microcannula that can be a minimal invasive method to obtain clinical relevant numbers of stromal and vascular cells useful for autologous transplant procedures and for promoting tissue regeneration and neovascularization. The results are basically in two phases. The first one is immediate, straight after the treatment, because it is due to the filling effect of the procedure. But we also have an even more interesting improvement in midterm and long term that is due to the promoting of the regenerating and rejuvenating action of the stem cells, stromal and vascular cells. So after the immediate improvement, at 2, 4, 6, 8 months time, we'll still have to get some good results. The results usually are permanent, because obviously the time goes on, but the regenerating action, it's something that is due to real regeneration. It's not just a cosmetic and temporary effect, like for example Botox. It's not an expensive treatment compared to other surgical treatments, and usually we prefer to give a very little antibiotic cover in order to prevent any kind of infection.